If you could tell us how old you are, how tall you are, and how much you weigh.
Yeah, so my name is...
You don't need to say it.
Okay. I'm 30 years old, I am 5'9", and I weigh 180 pounds.
And when did you first notice that you may have gyno?
It started when I was probably like 12 or 13 years old. Discomfort, playing around, joking around with friends, sometimes doing the whole, purple nipple. I started hurting from my chest. And then I didn't really phase it until I was 20 again. It felt like one side was always bigger. And about 2 years ago, I did a biopsy just to check what it was, hoping it wasn't cancer. So we just took a small specimen of the place of the cyst or gland, and it was good. There was no cancer. But then it bothered me just because it was sore. It looked funny. My body fat being low, I felt like I could see it all the time. My friends would say like, you're okay, you don't see anything, but it was mainly me that had a subconscious like attachment to that place. So I reached out to doctor, and he said, you're not crazy. You're actually understanding what your body is feeling and seeing. So I feel pretty good. I feel like now no pain, a little soreness, but other than that, it was good.
And you mentioned that you had pain with the gyno before. Was that something that was kind of like always there, or did it come and go?
Yeah, it always came and go. I felt like it was other things. I don't understand what it was. Maybe it was stress. Maybe it was caffeine. Maybe it was lack of sleep. But until really this last year that I did the procedure of checking what it was, I don't know if it just blew up and it started growing more, but I just felt discomfort. I wasn't really even taking off my shirt when I'm, known for that in my workout, just taking out my shirt, running without the shirt. It's just, I didn't feel comfortable anymore.
Yeah, that's something I want to ask. Did the gyno impact your clothing choices or your willingness to take off your shirt at the beach or at the pool?
Definitely. Like shirts like this, which is, a good brand, I would say, like Lululemon. It was a little bit more closer to my chest, so I couldn't wear it. Just felt that my nipple was just popping out. And again, it was me. It wasn't anybody else telling me, hey, what's wrong with your nipple? Taking off my shirt at the beach, I had to kind of like get in the water so my nipples look normal instead of one being puffy in comparison to the other one. And so, I felt, I didn't feel myself. I felt like it was always like behind my mind. And, I told my colleagues, my friends, my employees, and they're like, dude, nothing's wrong. I don't even see it. It may be nice for them to make me feel more comfortable about my own skin, but it definitely wasn't for me.
We do awake surgery, so we don't put people fully to sleep, and a lot of people are always apprehensive about what that is. Can you tell us what the experience of the surgery was like yesterday?
Yeah, definitely. Doctor, you did a great job yesterday in just making sure that I was fully medicated before, doing the procedure. You took your time knowing that I was having the effects of the medicine, and we, asked me some questions. We sit down, talked about some stuff, and then, he just said, hey, what music do you like? I felt comfortable. I laid back. I didn't feel much anything, to be honest. I requested a little bit cooler air just because I get hot all the time, and it was just right on. I didn't feel discomfort. I walked out of here, went home. I ate some Chipotle and like a normal day.
Nice. Good morning. So we're doing a unilateral gynecomastia case this morning. One question I often get from guys is, why doesn't the person just lose weight or get into better shape? And for this gentleman, he's a good example of someone who's in about as good a shape as you can be and still has gynecomastia. In his case, we suspect his gynecomastia is going to be entirely glandular. You can see it's kind of on the left for him. It may be difficult to appreciate. We outlined the margin of the anesthesia. So everywhere within the dotted line is going to be numb. And with him, if he pivots a little bit, you could see the left nipple kind of protrudes a little bit as compared to the right. And the reason for that is the solid mass that you could feel. You may not be able to see it, but you could definitely feel it. And for him, if he were to wear a tighter shirt, there's going to be an asymmetry in the nipples. For most regular people looking at him, they're just going to see a guy that's in great shape. But for someone that puts as much time and effort into his appearance, into his physique, it bothers him. So we're going to remove it. And I think he's going to have a great result. For him, it's going to be straight gland removal. Unilateral gynecomastia case for a young gentleman in great shape. Here's an example, and we'll show you the after result in just a little bit. For other guys struggling with gyno, like you were, any words of wisdom or advice you'd give to them?
Yeah, I mean, you know more than anyone. Like, you know your body well. You understand how it feels, how you touch your body, and you said, this is not right. Some people, including myself, I'm self-aware of how I'm building, where I'm gaining, where I'm losing. And this is something that, being on a low body fat percentage, sometimes I felt like I didn't feel comfortable being there. So I had to almost build more fat so I can feel normal. It's no shame, right, to have these certain things. And I feel like it's very like a touchy subject that men are not supposed to be, going under the knife and taking care of themselves. And it might be just, a stereotype because, for whatever reason you care too much about yourself. But at the end of the day, it's, you are yourself, and you want to feel confidence when you are out, when you're at the beach, when you're taking out a shower, when you're working out. There are certain things, certain shirts, like a white shirt, I couldn't wear because it was just like nipple was popping out because of the gland being exposed. So, to men out there, really try to, do something better for yourself. And if this is going to be an opportunity for you to feel confident again, take the risk.
At what point in your life did you first consider surgery?
It's kind of like when you're young, you feel invisible and you think nothing's wrong, right? Usually in your 20s, right? And you're like, you can do whatever you want. You can run around 10, 20 miles a day and come back, nothing's wrong. I always thought it was normal, right? I was like, no, I'll go away, I'll come back. But, I talked to buddies of mine. I said, hey man, like, have you ever had this? Yeah, it goes away, don't worry about it. And you take this medication, it'll go away. And you take this certain thing, it's a ashwagandha for your stress, and you take these roots instead of that caffeine, and you feel better. I'm like, nothing really worked. I knew that at the end of the day, it was something that my body produced, and it was, a form of not like they didn't want to be there, and that's why I pushed it forward. So when I considered surgery, it was about when I was 27. And, I just recently opened up a business. I was a little bit more stressed out. I didn't sleep much. I was definitely drinking a lot of caffeine, over 500 milligrams a day. And I was just thinking, no, I'm just doing it to myself. If I was or wasn't, that I was still fixated on that gland and never went away. I did something about it. I talked to doctors and they helped me and they did a biopsy. I was hoping that would take off enough so it wouldn't look more, but I felt like it just needed to take a whole extract out of that gland. So that's what we did yesterday.
And seeing the gland, holding the gland, touching the gland, is it smaller, bigger than what you expected, just about what you expected?
A lot of people told me, that's just going to be a small gland, don't worry about it, the size of a quarter. And I'm like, and I would always say, like, you don't feel the way I feel inside. Like, you don't feel that big giant ball in my nipple area. You don't feel what I've felt sometimes, that I pick up my hands and put them to the side and I flex and I see that huge ball. I knew it was going to be big, but I didn't think it was going to be like how it was yesterday. And a lot of people were surprised. Showed a couple of my friends and clients were like, you had that? And I was like, yeah, I've been telling you for the last 3 years, I've had something wrong with me,
What are you most looking forward to now that it's gone?
Yeah, I'm definitely, I'm like I said, I criticize my body a lot. I want to get to a low percentage of body fat and look good. I definitely want to get out to the beach and take off my shirts and work out more shirtless. Just feel confident with myself, like not kind of looking over my shoulder, constantly looking at the mirrors on my gym to does it look bad this way? Does it look bad this way? Should I like pop up my shirt? I just felt uncomfortable at times. So.
And now it's gone permanently.
Yes.
All right. I think we'll leave it at that.
Awesome.
And appreciate you.
Yes, sir. Well, thanks, man.